raise your hands. You walk into the patient's room, and then you're gonna tell your patient, Mrs. Pearl, I'm here to put a Foley catheter in, or in and out catheter, because you've been having trouble going to the bathroom, or because whatever you need to tell her. And then after that, you still verify the patient's name. You still say, can you please tell me your full first and last name? Okay. And then once you verified your patient, then you can go ahead and get your pericare done. And so that would mean you're exposing the patient, you're using soap and water or wipes or whatever your facility is doing. And then it would be helpful if you just left the patient, you can cover the patient up after you are done doing pericare. But then once you're ready to start doing the sterile procedure, make sure that you pull the gown back and just drape the patient the best you can and provide privacy. And so sometimes you can just wrap the legs a little bit in the towel and place the towel over the abdomen. But once you are sterile and once you have the gloves on, you don't want to touch this gown anymore. And so you can sort of give a little bit of privacy for now as we are setting the sterile field. But then remember to go back, and if you didn't, then you need to ask somebody else who's in the room with you to pull that gown up. So sterile principles, remember, hands always stay above the waist level, and you can turn your back onto your sterile field as well. So that may mean that you want to position the table this way or this way, kind of move it around and see what works best for you guys. Okay, so you will wash your hands. I can do that right here so we don't go too far. And I have a garbage bag or garbage can right here, so once I'm done I can just move things. Okay, so we're exposing our patient a little bit, and then I'm just going to start opening things up. Note that I'm trying not to go over my sterile field. I'm to the side of my sterile field. If I reach over, it means I've contaminated and I need a new set. So corners are contaminated, so 2 inches on each side. Open this up, and I'm going to give it a little tug just because I want it to stay open. And so now this one comes towards me. It exposes my sterile field. I'm just going to leave things the way they are here. Everything inside is sterile. I see my sterile gloves. I'm gently going to reach and pinch in just a little corner there and bring it over here. I'm going to move my body rather than just go over things. Setting this up. There is a little bit of overlap over my sterile field. That means that piece is contaminated, and I need to be mindful that I don't put anything there. So pinch, lift, step back, lift up, and put it on. I am watching the fingers, my fingers, but also the glove where it goes. If it touches anything, then I need a new pair of gloves. I'm going to scoop. I kind of pulled on the cuff a little bit, so it makes it easier for me to slide my hand in, step back, and put the glove on. Note that I'm keeping this hand away from bringing it too close to my arm because I don't want to contaminate. It's not exactly perfect, but I don't really need sterile wrists, so I'm gonna let things be. I'm gonna reach in. I'm going to grab this. It has a corner there, so you can pick up by that. You can open it up, And I didn't ask you before, but how do you think I should put that in? What side down?
The plastic part towards the bed.
Yeah, so
White
I'm gonna
part,
turn
yeah.
it this way so you guys can just see. Do you see that? So if I wrap it around my fingers and kind of slide it in, it's not ideal, but it will work, I think. And if it touches your gloves, like it kind of did, came over my whole hand, then you just need to get a different pair of gloves. And that is totally, completely acceptable. Just recognize that you broke sterility and what you would need to do to fix that. So if I were to do this again, I would probably just go ahead and straighten this out first, and then get a new pair of gloves. Okay, so since I contaminated myself, no reason to not fix it, and then I can get a new pair of gloves. So once you have a new pair of gloves on, you can step right back into it. Now, if you have to go somewhere to get a sterile pair of gloves, that's a problem because you're leaving your sterile field, so you can't do that. So you either start all over again if you have to, or you can ask somebody to bring a sterile pair of gloves. And as we talked, especially in the beginning, you're probably not going to be the only person who's doing that. You'll have somebody with you. Okay, so we'll look inside and see what we have. We have I put two of these in. So you have the swabs, and so we're going to drop this in the garbage or near it. I think it went in, and I'm just gonna leave it. I can leave it in, I can leave it outside. You guys can think about what works best for you in that aspect. This is sterile, right? So we can leave it here. I have another set of swabs there. So I have this, and we talked about the limited use of this. So you can either drop it over your patient for some privacy and some just kind of visually where your sterile field is. You will have a little lubricant, and I have a lot of these little things, so if you want to take extra home with you if you need to, let me know. Okay, and so what else I have is the actual catheter in there. We can squirt some on the catheter, or we can insert it and leave it in, whatever works for you guys. And if you had a little sterile cup, you would set it up if you needed it, or you would dispose of it if you didn't need it. I'm gonna drop this in because I don't need it anymore. I'm going to bring this whole thing over to where my patient is. So my sterile field is right here. I've got my swabs in here. You know, just if you can't leave them where they are right now, because you would be going over the entire sterile field to reach them. So that's not going to work for you. You can take them out and set them on the side. It's entirely up to you. Another option is some people who are very dexterous can hold this and like so, and still have the labia open. If you're one of those people who can do that, then go right ahead. And so the way it would work is you would kind of spread and contaminate, but then put this here. And so if that works for you, that is fine with me. We will do it, we did it the other way, we can do it this way now. So side and dispose, side and dispose. Make sure you're keeping everything open, that it doesn't close on itself. Then middle and dispose. I'm reaching in to grab my catheter. I'm wrapping it in my hands, and then I'm going to go in and back up, in and back up, in and back up. I see the urine it further in. Drain it in the cup. Then when you need to take it out, gently pull it in. Wrap it in your glove and dispose of it. Okay? Okay. So we did it a couple of different ways. We held it in this hand, and then we had it set up on the table as well. So whatever works for you is fine. Practice, just really find a feel for it. Okay, done, right? Questions?
We had the first time it was over there.
Yeah.
It was there. Okay.
Yeah.
I think I'd be thinking too much of